Hello everyone, my name is Dr. Naz and today I'll be discussing about abdominal aortic aneurysm. So, abdominal aortic aneurysm refers to an abnormal dilatation of the abdominal aortic wall. An aortic aneurysm occurs when the aorta wall swells to more than 1.5 times their size, carrying the risk of rupture. The risk factors of aortic aneurysm include male gender, family history of aneurysm, hypertension. So hypertension causes arteriosclerosis of vasa vasorum supplying the aorta that causes ischemia and weakness of its wall. Hyperlipidemia also causes aortic aneurysm because of plaque atherosclerosis. Smoking by endothelial injury and advanced age is also a risk factor. So there are two types of aneurysm, true aneurysm and false aneurysm. True aneurysm occur when all the layers of an intact but attenuated arterial wall are equally dilated. And false aneurysm, also known as pseudoaneurysm, is just a defect or a hole in the vascular wall that leads to accumulation of blood, and it looks like aneurysm, but it is a pseudoaneurysm. True aneurysms are of two types, saccular and fusiform. So when there is dilatation of the arterial wall symmetrically, then it is known as fusiform, and the asymmetrical dilatation is known as saccular or baryaneurysm. However, in false aneurysm there is just a hole or leakage in the wall of the artery, and it leads to accumulation of blood in the extravascular connective tissue. 90% of the abdominal aortic aneurysm start below renal artery and 15% extend to common iliac artery. The mean age at which the patient present is 65 years for elective cases. What are elective cases? Those patients who are asymptomatic, who have came to the hospital for the monitoring of other kind of diseases, but they found abdominal aortic aneurysm incidentally. So these patients require monitoring. And 75 years is the median age of presentation for emergency cases, those patients who presents with rupture or any other complications of aneurysm, which I am going to discuss. So the complications may include rupture, which presents with sudden onset of abdominal pain and hemorrhagic shock due to rapid onset hypotension. And rupture can be anteriorly and it can occur posteriorly as well. So the rupture which occurs anteriorly, it will spill the blood into the peritoneal cavity and it has poor prognosis and it is fatal. Whereas the posterior rupture will lead to the accumulation of blood into the retroperitoneum and patient is transiently stable, but the patient will require surgery, and without surgery the patient may deteriorate. Thromboembolic ischemic event is another complication of abdominal aortic aneurysm, and it presents with lower limb and mesenteric ischemia. And other complications include renal failure and death. So the investigation that is required is contrast CT scan. Other investigation is abdominal ultrasound, which is usually used for screening and surveillance test for the patients who are asymptomatic. So screening guidance is all men above 60 years of age with family history of abdominal aortic aneurysm requires a screening, and all men 65 to 75 years with prior tobacco use. So they should undergo screening and surveillance with abdominal ultrasound. So this is the radiograph of contrast CT scan, and it is showing abdominal aortic wall and its lumen is enlarged. So this is how abdominal aortic aneurysm looks. This is sonographic image of abdominal aortic aneurysm, which is showing the lumen of the aorta as well as thrombus in the lumen. So this abnormal dilatation of abdominal aorta obviously requires a repair. So what are the indications for repair? If the patient is asymptomatic with abdominal aortic aneurysm of more than 5.5 centimeter, because it has a risk of rupture. Rapidly enlarging abdominal aortic aneurysm also requires repair. Symptomatic abdominal aortic aneurysm regardless of size. Distal embolization regardless of size. Mode of repair is endovascular aneurysm repair, which is the ideal method for infrarenal abdominal aortic aneurysm. other repair is open surgical repair. Open surgical repair is the mode of choice for elective and emergency cases. The 30-day mortality rate is 5 to 8% in elective asymptomatic cases, 10 to 20% in emergency symptomatic cases, and 50% in ruptured aneurysms. I hope you learned something from it. If you do, please like my video and subscribe to my YouTube channel. Thank you so much for watching.